We are living in the greatest age of health information the world has ever seen. You can Google symptoms in seconds. You can ask AI. You can watch experts on YouTube. You can listen to nutritionists, trainers, psychologists, longevity experts, and weight loss specialists. You can learn about almost any medication, supplement, diet, or treatment from the phone in your pocket. And yet, we're not becoming dramatically healthier simply because we have access to more information. So I want to ask you a question. What if our problems isn't that we don't have enough information? What if our problem is that nobody taught us what to do with the information and how to put the information together? This is a term I call the gray zone. What is the gray zone? As an urgent care doctor, I deal with the gray zone almost every day. Some health decisions are obvious. If you're having symptoms of a stroke, you don't need 3 podcasts and an AI search. That's black and white. But most of your health does not work like that. Should I take vitamin D? Should I try fasting? Should I take a GLP-1, 2, or 3? Does this cough need treatment? Do I need an antibiotic? Should I worry about my cholesterol? Do I need more protein? Is this symptom serious enough to see someone? Those aren't necessarily yes or no questions. The answers may vary between maybe, sometimes, or well, depends on your symptoms. The answer is not black or white. The gray zone is the space between having information and understanding what that information means for you. And almost everybody lives here in one way or another. Think of health like a puzzle. Imagine somebody dumping a 500-piece puzzle onto your kitchen table. Nutrition gives you 75 pieces. Exercise gives you 50. Your doctor gives you some, your trainer gives you some, a podcast gives you another handful, your favorite Instagram expert gives you another 20, and then AI. AI gives you access to hundreds more. Pretty soon you've got more pieces than you've ever had before. There's only one problem. Nobody gave you the box with the picture on it. That's what I think is happening in healthcare. We're accumulating pieces without understanding how they all fit together. That's also one of the reasons I created the Prime Method. Inside the program, I'm not trying to throw another pile of pieces of health information at you. I'm trying to help people understand the picture so that those pieces can see where they fit into your health. Then I keep teaching. I had my own gray zone recently. I actually discovered it outside of medicine. When I started building this program, I knew what I wanted to teach. I knew the problems I wanted to solve. What I didn't understand, though, was how to actually build the business and the program around it. So, like you, I watched some YouTube videos, some reels, some Instagram posts. Then I ended up hiring somebody for this piece, and then I ended up hiring somebody else for this piece. One person understood websites, another person understood funnels, another person understood advertising. Someone knew about course creation, someone else knew about messaging. But the frustrating thing was most of them knew something useful, but everybody was trying to solve one small piece of my problem. I spent way too much money and way too much time collecting answers. Eventually, somebody helped me step back and identify the actual problem. And then suddenly, things just started to fit together. Finally, I remember realizing this is what people have to do with their health every single day. Where do people go for answers? Well, AI can be incredible. I use it myself. But AI works best as an assistant, not as a replacement for medical judgment. The quality of what you get depends heavily on the information you give it, the questions you ask, and your ability to recognize when the answer doesn't fit. That's something I spend time teaching in the Prime Method, because AI is not going away. We need to learn how to use it intelligently. And like my example above, I kept throwing information at it and it gave me what I needed, but it wasn't quite figuring out what I actually needed. It took 5 years and lots of searching. So what about your doctor? Your physician should and can be one of your best resources. But imagine trying to cover weight loss, nutrition, exercise, your sleep, medications, vitamins, chronic diseases, your mental health, prevention of chronic diseases, acute disease, and things like that. Then what about the hormones? And what if you have a cough, a cold, or a different illness that you need diagnosed, treated, and know how to prevent it in the future? And then whatever other symptoms you're having. And you're trying to accomplish that all in one appointment. It's just not possible. You'd need another appointment almost every week for the next 6 months for just today's problems, from what you've seen on the internet, from what you're currently battling with your body. Let's not even start with tomorrow's problems. The issue isn't that doctors don't know anything or that they don't want to help you. The healthcare system now is not designed to provide ongoing health education. There just aren't enough providers to do that. And even at that, you have to deal with their biases. Not everyone agrees or sees the place for all of these different techniques and therapies in people's lives. That can be a real problem if you want to try something new. Then you have social media. Social media gives us access to some brilliant people, amazing people. But the algorithm on those social media have one job: to keep you watching. So nuance loses to stop eating this one food. You click it, you learn something, and then you realize you've gotten a puzzle piece to your large puzzle. The bigger lesson, though, I'm an urgent care physician, and I also own a med spa wellness clinic where I've worked in areas like weight management, energy, and wellness. And eventually I realized I spent most of my professional life working inside the gray zones. Is this viral or bacterial? Do we treat now or wait? Is it good for home or do you need an urgent care? Do you need the urgent care or the ER? Do I need to give medication, supportive care? What information actually changes my decision? That's what clinical judgment is largely about. And that's what I'm trying to help people understand through the PRIME method. Not to turn you into your own doctor, I'm just providing education, but to make you a much more educated participant in your own health. We don't have an information shortage. We have an understanding shortage. And I believe that as technology gives us even more information, understanding is going to become more, not less valuable. That's the gray zone. And learning how to navigate it may be one of the most important health skills you can develop. Now, if that's the kind of health education you're looking for, that's exactly what I teach in the PRIME method. The information to join us is below. I hope to help you and see you soon.